everybody. Hi, Dr. Jeff Benton, Houdini of Healing here with another demonstration of how we can fix low back pain and diagnosing low back pain correctly. I find this condition I'm going to share with you very often. Patients come in with low back pain, and I feel that this is probably the most commonly misdiagnosed low back issue going on. You go to a neurologist, you go to an orthopedist, they'll talk about a disc issue, send you to an MRI, send you to cortisone shots. What we need to do is also assess the sacro-iliac joint. So I have a patient here, and she came in with a myriad of complaints, including low back pain. One of the muscle tests, I did two things. One, I do a muscle test. So I had her bend her knee, hold her leg up here, and hold strong, and she has no power. She cannot keep that leg up against my arm, and the other one, pushing up, and no power. So that's a muscle test that's weak. Now, I'm going to share with you, I would do her hamstring muscle, so bend your knee, everyone, push against my hand, solid as rock. I can't budge the hamstring muscle. And this one, hamstring muscle. So the hamstring muscle actually anchors on the back of the leg and goes down to the bottom part of the legs. But the G-max muscle actually anchors on the hip, and it anchors on the hip and it goes to the back of the leg to raise it up. Now another thing that I do is I actually do what's called an iliac compression test. I'm actually putting my hands on the sides of her hips and pushing together. Does that feel better?
Yes.
Put a number on the pain now that I'm holding your hips together.
5.
A 5. And without it, what's the pain level now?
8.
Okay, so just repeat in case you didn't hear her. She has the low back pain of an 8, and whenever I push her hips together, it comes down to a 5. And I'm going to explain to you what's going on. So she has a classic sacro-iliac strain sprain. And so you have the sacrum and you have the pelvis. And if you look at this joint closely, it's a shallow joint. So that means the joint, the way it was designed, was relatively unstable in the design. What holds this joint together is a bunch of ligaments. Ligaments are laid across from the sacrum to the hip on both sides. Now ligaments are like rope. If you overstretch rope, it's overstretched. You have to throw the rope away, get another rope. In contrast, muscles are designed to spring forward and spring back. So I would say that muscles are more like bungee cords, while ligaments are more like rope. They're supposed to fasten things together. So she has a ligament injury at her sacro-iliac joints. And there's pain fibers in these joints. And whenever the sacrum is pulled apart, then the pain receptors send a signal to the brain saying, hey, it's hurting, and try to stabilize it. Then all the muscles in the low back try to fire to try to stabilize it. And it's futile because these muscles don't cross the sacro-iliac joint. I have a sacro-iliac, also known as a trochanter belt. This is a support brace. It's a Band-Aid. It's a Band-Aid for the hips. She actually has a very small waist, so she would fit a small. Take it, lift up your hips for me. Thank you. Put that in here. And I tighten it up, like my hands there. Put some nice tension on there. Snap it down. How's it feel now?
Feels good.
Is it like a 5 or less than a 5?
A 5, yes.
Okay, so 8 to a 5. But here's the other magic. Now lift this leg up. Pushing up, and her leg holds strong. So by stabilizing this joint, her glute max muscles are now able to fire correctly. Hold this leg up. I'm pushing down on her and she can resist it. So it's not 100%, but let's say it's at 80%, and then I'm going to do a few adjustments to get these muscles back to 100%. So when she leaves this office, she's going to wear this belt all the time. So it's a combination of a chiropractic adjustment to make sure that these muscles are firing correctly, realigning the pelvis and the sacrum and the rest of the low back. And she has gone from an 8 to a 5 in one session, and I expect it to heal up. I'll probably check her on some specific nutrition to help the joints heal up even faster. Thank you for watching. This is Dr. Jeff, Houdini of Healing.
Hi, my name is Greta. I came here with a very painful pain on my back and my shoulder and my neck. We just made some adjustments, and especially to my hips and my lower back, and I feel very, very better. And I suggest everyone to come here to Dr. Benson because he's very good and he can help you to overcome your pain.